Good morning. It's Friday, March the 7th, and I thought I'd do a video this morning to look you in the eye and in hopes of motivating you and getting you up and running better than you are running. I guess there's a little bit of problem with Blackboard, new Blackboard, in the sense of posting. I've made the assignments. I can never find what you've posted there. I have to go to the email. So I sent you an email a little while ago that from now on, all the assignments, all the way through the comprehensive essay, send through the OLLU email. We won't worry about trying to post. The assignments are out there. I've made the assignments all the way through the comprehensive essay. It's due March the 2nd, I think. But let's use the OLLU email. Having said that, only 2 of you have submitted assignments for segment 1. No one as of yet has submitted an assignment for segment 2, which was due this past Friday the 31st. That's income inequality. I have here written assignments due January the 7th, due January the 31st. Let's say that I think we made the principle, did we not, that you have an extra week. So we have the discussion, which I'll get to here in a minute. We have the readings and the discussion January the 18th through January the 31st, and then a week following that, February the 7th, which is today, is when those assignments are due. So perhaps I'm speaking too soon. Your assignments will come in by midnight tonight. Each of you will have an assignment by midnight tonight on the segment 2, health inequalities. But anyway, send those by email. And then social cohesion, which we've begun, goes through February the 14th, a week from today. And so that written assignment will be due on February the 21st, Friday, a week later. Give you a week to write after the discussions, the videos, and prof's notes. Okay, so now back to discussion. Only Miss Reese has posted discussion once, which is okay. Once in segment 1, once in segment 2. I just put in a discussion thread for segment 3. So I'm encouraging you, I'm urging you, indeed I'm requiring you to get into the discussion. I hate to require it. It's supposed to be a stimulating course that gets everybody eager enough to get in there and want to talk about it. So get in there and want to talk about it. You know, the basic theme we've been working is, as we get past segment 1, which is about how to specify the outcome variable demographically, using data from birth, and largely data from birth and mortality records. Segment 2 was to look at population health from the standpoint of income inequality, social inequality. We know a lot in our country about health disparities. Those health disparities reflect income inequality. And we're not talking about how I am or you are or anyone in the family is, although those are indeed very important dimensions. We're looking at this from a population standpoint and how are populations influenced by this. Now, as nurses, as I think all 3 of you are, then it's important for you to know the personal experience, not only of yourself, so that you can understand your own heart, as nurses do, in the treatment and care of those that they're charged to care for, but to have a sense of what is upstream that's bringing that person here. What is their context? What's the social and economic context that brings that individual here? And you can imagine that in that context, say, of the neighborhood, there are many others similar to the one that is sitting in front of you or lying on a bed in a hospital in front of you. It's to get that larger context of what is going on. The upstream view, something that I know in medical school it's already required, and as we've mentioned this in the spring of 2015, for undergraduates to have a course like in Sociology of Health, to have an idea of contextual influences and upstream effects on individual patients. So that's what the course is about. You're getting a head start on this, and so get into it. Here, we're in this segment 3, we've discovered, or we're considering, our hypothesis is that if you look at the Robin Hood Index. As you move across, I've written a little bit about that this morning in the discussion. As you move to the right on the x-axis, income inequality increases. And as it increases, the rates of mortality increase on the y-axis. So that it's clear that income inequality in that sense is having an influence. It's an issue of access in terms of inequality, and we know, all of us know that to be the case, especially those of us in healthcare. And but here, what we're looking at now is, what does that do for the social cohesion of a community, be it the United States, be it Texas, be it Bexar County, be it San Antonio, be it Harris County, be it wherever we are. What are the implications of inequality on the cohesion of the community? If the cohesion begins to dissolve and break down, the equation that we're looking at, and go back to Bruner, that Bruner article and the Bruner video, that as social cohesion diminishes, then stress increases, the autoimmune system is impaired, and Bruner speaks specifically the physiology of that. You may already know something about that already. And then the risk of ill health increases. So if we think about the dynamics of social context, if we can improve those in some way, then we would expect downstream health-related behaviors would improve, and as a consequence, health profiles of population would improve. And yes, you can take it on the individual basis if you wish. But in the course, we want to stay up in the larger view of population. So, and then the next segment will be which will enfold into the comprehensive essay, is networks as actually the fabric of the social cohesion. And if there's no fabric, then the cohesion fabric is torn. It's not connected. It's tattered, shall we say. And to the extent that there's good networks, social networks, then the more integrated an individual is socially in the community, and less stressful. That's the argument of the course and in all the social determinant literature that you're reading. So anyway, I just wanted to do this video to give you some fresh eye contact. There are some videos out there. Look at the video. There is a video on the specific, I think there are two videos on the specific theme of this segment. One specifically on Sampson's article, and I posted some notes on that today. And one on sort of the articles, the other articles, the theme of social cohesion. And I posted some notes on that today. So send me your segment 2 assignments via email. They'll be due tonight, Friday the 7th. And get into discussion. We have another week to go on this before this discussion period ends. The segment ends on the 14th of next week. It's a Friday. So I don't know where you are. One of the downsides of being online is no telling where you are. And I'm in San Antonio. It's been cold here. I don't think it's going to get much above 40 today. I don't think it got much above 35 yesterday. And for us, it's been cold. So I hope you are staying warm and toasty and cozy and are doing okay health-wise. And hope to see you in discussion this next week. You take care, you hear?